My name's Zara and I'm a counsellor and psychotherapist specialising in art and play therapy with primary age children and adolescents. Today I want to talk to you a little bit about anxiety and depression in young people. Just like adults, children can get anxious and depressed. And there is a spectrum, and some of that is normal. But obviously there are certain signs and symptoms to look out for when it's starting to cross into a territory where maybe we want to think about an intervention for that child or young person. So let's start with anxiety. Some of us are just hardwired to be more anxious than others. So I think it's always worth, as a parent, thinking, am I anxious? Was my mother anxious? And could I potentially have passed those things on knowingly or unknowingly to my child? Some of this is biologically hereditary. So like I say, when I say hardwired, I mean neurologically in terms of the way your brain is. Some people just get a much bigger flood of those anxious hormones for what another person might experience as a minor event. So anxiety is worry, but what we want to think about is when that anxiety starts to inhibit your child's ability to engage naturally in their day-to-day. So if a child starts to complain about things like tummy aches and headaches, that can be a sign of anxiety. If it's typically associated with a particular time of day, like going to school or going to sports events or after school clubs, those might also be telltale signs that your child is struggling with some anxiety. Anxiety can also manifest in low self-esteem. So maybe that child or young person starts to talk about themselves in a very negative way, in a very self-deprecating way. That might be a sign of anxiety. We can also look out for things like a lack of desire to engage socially or isolating themselves. Fortunately, there's lots you can do. There are some really lovely workbooks that you can start to look at with your child about working through some of their anxieties. There are therapies such as CBT, cognitive behavioural therapy, which is about rationalising and unpicking some of those anxious thoughts and asking your child if there's another way they can think. For example, if your child sees a friend and waves and that friend doesn't wave back, they might immediately think that they've done something wrong. But we can question them and challenge them and say, well, maybe your friend didn't see you, maybe your friend was having a bad day. So CBT works to challenge our automatic negative thoughts and give us other ways of thinking. Of course, you can take a more longer term approach with things like art and play therapy to see why maybe your child is naturally inclined towards anxiety and what strategies you can put in place as a family to help your child with their anxiety. So now I'd like to talk a little bit about depression in children and young people. Depression is much more than feeling a bit sad. Depression often manifests in a real inability to have any desire to get up and get out of bed in the morning. Often these children will become very withdrawn socially. They will isolate themselves in their bedroom. They might stay up really late watching TV and playing with their phones or chatting to their friends. They might suddenly be very hungry and eating all the time, or they might severely restrict their food and lose a lot of weight. These are some of the key things that I would look out for if I was concerned about depression in a young person. We often want to think about the causes, and sometimes it could be bullying, it could be exam stress, it could be pressure, it could be changes in the home environment. Again, these things can be somewhat genetic, and if there is a family history of depression, then it might be worth looking out for that in your children. As always, early intervention is key, and there is a lot that can be done to help a child that's struggling with depression. In very extreme cases, with children over the age of 16, medication might be used, but often it's a very last resort and not something that's necessary in most cases. If your child is self-harming, this again can of course be a sign of depression, but once again I would say that medication is not the avenue that you should explore immediately, but instead reach out for a local therapist. When you're working with a child as a therapist, often we will bring the whole family into it, so we will think about strategies that we can give the family to support that person. So if you would like any support from me, you can of course find me on the counselling directory. My name is Zara Kadir. or you can contact me on my website at www.choose-therapy.co.uk. Thank you very much.